Hi, Antonella. I'm starting
Hi,
first
Alex.
today.
You are wonderful. I've trained us well.
Yeah, nice to see you.
Good to see you too.
Yeah. So I'm going to take the lead because you usually
Okay.
take the lead, and this particular conversation today it was coming together as a result of a particular area of interest and passion, enthusiasm and frustration on your behalf, which
Yes.
versions of this are also very frustrating for me and things that we've seen in different aspects of our practice. So that being said, why don't you tell us about what today's topic is all about and how it's a little bit different than our usual scenario.
Yeah. So we're going to cover cortisol and exercise, specifically in perimenopause, menopause transition. But I had been hearing on the interwebs and social media for a long time, lots of commentary on exercise. I will break it out into two. I think one has been stay away from high intensity exercise because it's going to drive cortisol and that's going to have this downstream effect that is negative, whether that's trouble sleeping or more anxiety or feeling sort of wired but tired. And so that was one scenario. And then the other scenario, which I had heard, was this real pushback on aerobic or sort of moderate intensity exercise, and that potentially this could be detrimental because it was neither high nor low. It was sort of mid range, that because perimenopause and menopause are cortisol dominant states, which we will cover, that will be sort of the first place we're going to land, that if we're sort of doing this moderate exercise, we're actually driving more cortisol or stress or sympathetic state that then is going to affect sleep and weight gain and weight loss. So we should really be doing more the opposite of the people who are against high intensity, doing a lot of high intensity with this big polarization between super high peak heart rate and then recovery, because that's sort of middle of the road, long bike rides, spinning, walking, cycling was going to be detrimental. And so I was very annoyed by this because I didn't know if it was true.
Yeah.
And I think I was also saying that it was making exercise super challenging because women were actually scared that they could exercise incorrectly.
Yeah.
Or do something that was gonna make their sleep worse, or make their weight gain worse, or their mood worse. And so it was actually, there were lots of these obstacles to getting exercise on board. And I am such a fan of exercise, and I think it's super underutilized. And I personally feel it's super important to my own mental health and well-being and all of these things. So I brought this question to Alex because I was there's another brain that can look at this with me. It would be really helpful. And I think we would look at it from different angles and be able to discuss it. And I think it's a question women have and they're being bombarded by, and it's just making them super confused. And that saddens me because I feel we need less obstacles to get moving rather than more.
Yeah. And
so that's where we are.
Yeah, that is where we are. And initially we had talked about doing a 3-episode series almost of here's the first concept, here's the second concept, and how do these things come together? And then when we started to dive into it, realizing that almost the original premise, it's not that it was faulty per se, but it everything fell apart starting at the initial premise. So it meant that we could look at this a little bit differently and talk through our investigation. So this one's a little bit different because in the past we've done, here's a study with a particular topic and we're going to run through the study, talk about the quality of the study, the findings or the results of the study, and how it applies to clinical practice for us and what it might mean for people at large. With this, it's a bit different. So we already agreed that this is going to be a little bit more toing and froing and talking about what we've read, because we went through a number of different studies about cortisol, about menopause transition, about exercise in particular in relation to both of those things, and then some outlier pieces. And so we're just kind of weave our way through what we learned and what was interesting and what was consistent and what was inconsistent, and why that means that we can even start by saying that exercise wins.
Yeah, so our first statement is big takeaway, exercise wins.
Yeah.
We will bring it back at the end.
Yes.
There's a little bit of nuance in there, but I will say not much. It's not going to be surprising. It's things we already know. Exercise wins.
Yeah.
But sort of our first stop then is this very bold statement that perimenopause and menopause is a cortisol state And I think the second part of that is that like cortisol as a good biomarker, up, down, correlated to stress, affecting outcomes. And what
Yeah.
we found was that like that doesn't really hold. Like cortisol seems to be a bystander here. Like there is some increase in cortisol during this time. There's a hormonal metabolic relationship. But from an outcome perspective, we're not really seeing that cortisol matters all that much. But Alex, I think you did a good review of this, so I'd love your take home on it.
Yeah, I mean, I think that is kind of the most straightforward way to look at it. There are lots of scenarios where we see a thing happen for reasons, but it doesn't actually lead to any particular outcomes or consequences or things that we care about or that we don't have that clarity, right? So I think what did become clear was that for many people at various points through the menopause transition, there does seem to be an elevation in cortisol. Like if you compare population, menopause transition versus, let's say, full on premenopausal, the chances of finding people in with greater elevations of cortisol is higher. So that does seem relatively clear, although it's not true for everyone at every stage in every scenario, of course. But like collectively, that seems to be relatively true. It also doesn't seem to be specifically related to like the stress of going through the menopause transition. There were lots of forays into, well, is it because having vasomotor symptoms or hot flushes and night sweats is inherently stressful for a lot of people? And do those sort of experiences increase cortisol levels? Is it, changes to mood? Is it that the sandwich generation concept that our menopause transition often occurs at a time where other things are going on, and that's kind of the relevant piece.
Yeah.
And the answer is maybe, but definitely no clarity around that. And in fact, I think with the vasomotor symptoms, there was lots of not being clear around
Yes.
like, are we seeing these direct links? And there was some discussion with at times some sort of compelling steps leading towards, like, there are some hormonal pieces there. So in the absence even of any kind of increased perceived stress or stress experience due to things like vasomotor symptoms, that there's something about the change to that, often what we would call the HPO, like the hypothalamic pituitary ovary axis, like the hormonal symphony, that is starting to quiet and like just enter a new stage,
New melody.
a new melody, a new soft, gentle melody.
Yeah.
That there's something about that that probably informs what cortisol is doing, and that is not related to anything otherwise. And as almost a result, although that's not clear either, just having elevated cortisol through that menopause transition may just be a consequence of going through the menopause transition and not be related to other things and not relate to other things, right? If that lack of clarity is clear.
Yes.
Really, the takeaway was when people say that the menopause transition is a high cortisol state, there's some truth to that, I think. I think that's what
I
we
think so
left
too.
with, that there's some
Yeah.
truth to that. As to the whys and wherefores for a particular person at a particular part in their menopause transition, especially with variable intensity of symptoms and so on and so forth, less clarity around exactly why it looks the way it does at that point, and even less clarity around, does it mean anything? And in fact, I would
Right.
say there were more than enough studies to suggest it didn't mean anything that really well countered the ones that said that it did, that we were left with concluding that we have no darn clue whether
Yes.
it matters or not that menopause transition is a high cortisol state. And
Yeah.
so I think what we said to each other was, I mean, as a starting point, those people, especially the really convincing people on the internet, anyone who says menopause is a high cortisol state and you see bad things as a result of that, like, that certainty that comes out of their mouths has no bearing. Like,
Yeah.
there's nothing to support the strength of that type of statement.
Right.
I mean, we particularly love the nuanced conversations. That's part of our
Yes.
vibe. And yet we're able to say, yes, we see this change, we think, in cortisol, but like anything after that is like maybe.
Yeah, I think to be determined. And that also, like, just as you were talking, I think something that occurred to me is that I think we almost like override our own sense of ourselves with this like elusive cortisol, right? Like, it's like, well, if cortisol tells me I'm stressed on a test, right, like from the internet, then I'm stressed. But like, what I think I really took home is that there is some level of stress to this hormonal shift. It is coming at a time of life where there's financial, relationship, world stresses. And if we feel stressed, regardless of what the cortisol is doing, that is what should matter. And a stress reduction intervention helps, regardless of what happens to the cortisol.
Yeah.
So, like, if you feel stressed, I agree you are stressed.
Yeah.
Let's take care of it and address it, and that's going to be beneficial. And what's going on to cortisol seems less important of our understanding today.
Yeah. Especially because, as with all lab tests, there's a spectrum, there's a range, right? And setting aside the accuracy of certain methods of measuring A, B, or C, but in cortisol, like there's a million ways to test cortisol. There's a blood test, there's a saliva test, there's a hair test, there's a urine test, there's a 24-hour urine test, right?
Yeah.
So, like, these all have to be validated and they're going to have ranges to them. So, for you feeling stressed to this degree, what does your cortisol look like, and how do we confirm that that's a meaningful elevation or not? Like, those are extremely difficult questions to answer, and often we don't have the answer. Just because a test exists doesn't mean it can answer that question particularly well. And like you pointed out, if we're feeling stressed, that's a more relevant factor, right? Because it's just more specific to you, and we know we can work with that, right? Rather than sort of something at the high end of a range or just out of a range, and you're like, do you feel stressed? I don't know, I guess I do.
Yeah.
But
or
is that
someone
just I was just gonna say, or is that just like a normal amount of stress to some, like our experience of some difficult times, right? Like cortisol is meant to be a friend.
Yeah.
Like it helps us navigate our days. It's highest in the morning to give us get up and go. If we are confronted by a stressful situation, the release of adrenaline, if it's really acute and in the short term, and then cortisol is like a normal response to navigating stressors. And so then being able to go, okay, well, how much is too much is tricky. And then we have to look at, well, how do we feel within that? And I know I'm retreading some of what you said there, but I'm a big fan. There's so many validated stress questionnaires that have so much better data behind them.
Yeah.
Right. And so I'm sort of cutting around the whole conversation that this is what we talked about. We're going to loosey-goosey here.
Yes.
But the stress piece, I think, the cortisol is a component of that, but the things that we're really clear about, just in terms of being able to help someone, but also from like a validated investigation, and then seeing what kind of treatments can help reduce stress levels, which then lead to positive outcomes like better sleep and reduced weight gain, which we're going to talk about, and better mood and all of those things. We have clarity around that using stress markers, like not biomarkers like cortisol, but like how stressed are you on this scale, perceived stress scales or cumulative stress scales or whatever they are. We have that. It's solid evidence. If you're high on this, we do something to bring that number down and you feel less stressed, we are going to see benefits over here.
Yeah, totally.
So cortisol, come on.
Yeah. So like we don't understand cortisol with enough nuance, I think, to make absolute statements. And stress is like, if you feel stressed, we need to address it. And I think that is sort of the foundation to the conversation moving forward, right? Stress is a big component. We've got tools, we've got clinical ways to assess that. Yeah, but like we don't need to freak out about like micromanaging cortisol. And then, so then that brings us, I think, to like exercise in menopause is good for pretty much everything. Like,
right.
It's good for your heart.
That's the link, right? And it's also good for the stress, right? So
totally.
I think, like you pointed out at the beginning, the concern about, are we making people scared of exercising when exercising may help all of the things that we're worried about cortisol, that we're worried cortisol is contributing to? right?
Yeah.
So if we're worried that cortisol is contributing to, like you said, poor sleep, poor mood, anxiety, weight gain, and exercise has evidence that it can support all of those things in beneficial ways, where's the benefit, which is the question mark, where is the benefit in making people less likely to move their bodies because they're now concerned that's going to elevate cortisol and cause the problem when we have the absolute evidence that exercise can reduce that?
Yeah.
So I think where that left us was, is there evidence we're unaware of? I think it was two things, right? Like we are two
Yeah.
different people in lots of ways, and for you, it was like, do I need to like really hone in and be more discerning with my exercise recommendations for myself and my patients and the micromanaging of that? And I'm sort of more representative of a population who's like, moving is just a win, right? Like there's no
Totally.
micromanaging sometimes in the movement that I do. It's the fact that I got to move every day, which is what's going on, and we're good with that.
Yeah.
I certainly don't want myself or people like me to then be like, should I do that movement? Because then I'm less likely to do any movement, let alone
Yeah.
in a situation like yours where you're like, should I do this much of this type of exercise versus this much of this type of exercise, which is also stressful in its own right, that kind of micromanaging, right?
Totally. Totally. And there were things like I do want to highlight the sleep one because I think this is the one that like gets in people's head because sleep is challenging, right? In midlife. Like some people go through it unscathed, but for a lot of women it's super tough. But the exact intervention, like there was a very big like meta-analysis on exercise and sleep, and they did find, right, like aerobic, resistance training, Pilates, even things like Tai Chi, like all of them showed benefit. But like the most significant one on like actually showing like a 38, 37% improvement on sleep was on aerobic training, which was 30 minutes of walking 3 times a week. It was at like a pace where you're probably like not, you're not going to catch up with a girlfriend over that. Like you're going to be, feeling challenged, but not crazy hard. And so it was like aerobic training and they slept better. And so I don't think there's any reason we need to fear the
Right.
aerobic.
And
it's
to be
good for your
clear,
heart.
the
Yeah.
aerobic training is often what's maligned as being elevating cortisol, right? So I think that's the link we want to be really clear about, that often what you're hearing about is that we have this potentially inherently high cortisol state in midlife
Yeah.
and menopause transition, and doing exercise, especially aerobic exercise, especially long-term aerobic or like extended long aerobic exercise, will increase cortisol. And I know you alluded to this at the beginning, but I just want to like re-emphasize this as
Yes,
we
that's
go
helpful.
through.
Yes.
That type of aerobic exercise will further increase cortisol, making everything worse, including things like sleep, which are notoriously spoken as associated with elevations in cortisol level. And what you've just said is there was a really clear cut, large, meta-analyses of multiple studies pooled together suggesting that all exercise, including aerobic, very clearly improves sleep quality.
Yeah, totally. Yeah. And that specific like aerobic study, which was in 2024, it was like what we would, I think be a pretty gentle recommendation, like 30 minutes of walking 3 times a week. So very much that like mid-range, what people might see out in the world is zone 2, moderate endurance. And I think we underappreciate that aerobic training is what stresses our heart. And in midlife, cardiovascular disease becomes the number one health risk. And so we don't want to move away from cardiorespiratory training either, right? Like that's such a huge risk. And so we do that by elevating our heart rate and challenging our heart. And that can be done in a variety of ways. And we'll come to the weight loss part. I think that's where the nuance starts to step in slightly, but exercise for the win.
Yeah, exercise for the win, for sure. And I mean, we also, well, just alluding to that quickly, like we also have really clear cut evidence linking aerobic exercise in general, but aerobic exercise to improved mood, whether that be in depression or anxiety. So again, something that can rear its head for the first time or again in the menopause transition for a lot of people. Again, especially anxiety associated commonly with changes to cortisol, elevations in cortisol. Here's a tool that has lots of clarity and lots of support using it to reduce those things. And so whether it actually increases cortisol or not, it doesn't matter, especially with well, so what if it does?
Yeah.
Well, you know, like the proof is in the pudding. That's what I'll often say with
Yeah.
people. It's like, here's this and here's where we want to be. And this may sound like the best or the worst thing, but if we get to where we want to be safely and happily, that's
Mm.
kind of what counts, right? So if aerobic
Yeah.
exercise increases cortisol and we're in a higher cortisol state, but we sleep better and our mood is better, where are we going wrong here?
Yeah. 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 And I think something that we had talked about even like at the beginning of this discussion is, I've spent a lot of time in the trauma literature, and that's where cortisol comes up a lot. And so what's interesting from that perspective is that like when you see people who've experienced like a lot of trauma, right? Like when we go to like orphanages, like things that like genocide, right? Like those types of things, there's actually very little consistency in those cortisol patterns. And so one, that tells me again, right, like cortisol might be elevated and someone is deeply traumatized, but they could also have low cortisol and be deeply traumatized. Both those scenarios can happen. And that our cortisol doesn't just become significant at midlife. Like there's like 40, 50 years that have happened before that might have set us up or been like sort of certain wiring or plasticity in the brain that is actually more specific to us and our experience that then comes into play. But like they're not simple lines, right? Like there's a lot of complexity here. And I think to just hone in on midlife and also not think of like cortisol from a greater life experience and how we might have had like early childhood or right, like there's just lots of things going on.
Yeah.
And so I think we just need to appreciate how messy it is.
Yeah. And
As well.
and that we hang our hats on the things that we do have some clarity
Yeah.
with, and find the stuff that there isn't clarity about interesting and worthy maybe of continuing to monitor, like you said, TBD.
Yeah.
But someone who says that this is the way it is in relation to cortisol in midlife, and in particular with exercise, you can find a study supporting that statement, but you can find just as many suggesting that there's no relationship. And that's again going back because of our what we're doing here in Research Reflections, just going back to that concept of the idea with research is that you have to look at the totality, right? You can always find something that's going to support your statement or your point of view, but is it 1 in 100? Because the 100 is going to have more weight to it. Or even if it's 50-50, now you have no clarity, right? So you can make a statement and maybe that'll win out in the end, but you have no way of knowing that until we gather more information and we see, which way is that scale going to tip. And so, yeah, that's the thing.
Yeah. Okay. So we have a tip scale towards exercise
Yes.
in, bone health, cardiovascular health, mental health, sleep. And so then like if we look at weight loss specifically, right? Like so we've sort of like gone very big picture, cortisol, perimenopause, exercise, menopause, perimenopause. Now we're looking at like body composition, weight management, weight loss. And so this is, I think, right, like this is a subcategory of that bigger conversation.
Yeah.
And I think we also want to tread lightly that like whether or not weight loss is a goal, right? Like that's sort of a loaded conversation. I think there's lots of cultural factors here and body types, right? So it's not that we're sidestepping any of that. We're sort of just like carrying it in with us that again, this is a big conversation and we're probably not going to do all of the parts there. But there is this tendency towards more weight, fat deposition in the middle, sort of as that estrogen goes down. And so we do see this as a challenge in midlife. And so what type of exercise helps? And are there exercises that create harm, right? Like here comes the question again.
Yeah, the $1 million question, isn't it?
Yeah,
these
the
days?
$1 million question.
Like the UC out there is like
Yeah.
something that gets a lot of attention, rightly or wrongly. Yeah.
Right. Yeah. Rightly or wrongly. And so I guess I think our preface that we wanted was that like, in my opinion, I think this should be one of the things that we're holding as a priority, but in addition to all of those other things. So I would put it like with bone health, cardiovascular health, mood health. So ideally, we want a plan that is hitting all of those and not one at the exclusion of the others, because, we have said cardiovascular risk, number one risk, at this point, like super important to take care of our hearts as well. So, yeah, what were your take homes from the exercise and weight loss and body composition?
Yeah, it was complicated, and I was interested to see if it was gonna support the kind of prevailing wisdom, or not wisdom, but the prevailing statements, that yes, this aerobic exercise is going to cause more of a problem due to the nature of it. I think even sometimes it can feel almost like inherently logical. Like when something feels logical, you're more likely to believe it, right?
Yeah.
And so then when you see the research, you're like, oh yeah, no, for sure. That's the bias piece that often plays a role. And so if I think, oh, if I'm going to go for like a walk run for 2 hours, it feels more stressful to me than doing 10 minutes of something slightly more intense, but that's over. Like that just makes more sense to me, right? But that's a personal experience and personal bias. So anyway, I was interested to see where this was going to go. I'm going to throw the question back to you in a second.
Sure,
but
please.
but I worked more in the like what happens with cortisol and weight, right? Because that's part of the conversation too. It's like if again, the more direct link is exercise and weight, because point A, point B, those are the things we care about. Like,
Yeah.
does this thing that we do help the thing we want to change?
Right.
Regardless of how it's facilitated, right? By cortisol or otherwise. But part of that equation is, because this is the whole point of what we're investigating, does cortisol have an impact on weight?
Yeah.
And so I looked at that in a couple of different ways, right? Looking at people who take exogenous or external amounts of corticosteroids, so the like medication version of the stuff that we make, right? Like so prednisone versus cortisol. I looked at what happens when people have higher levels of cortisol just for other reasons or inherently higher levels. Does that increase weight? And is there a relationship with stress there? Because again, now we're talking about weight specifically. So I know we talked about stress, but now we're talking about, well, is there that relationship that increased cortisol, increased weight? So the couple of things that were interesting that I found, there were a handful. One starting with the stress and then cortisol weight piece. So one particular study looked at that and said, okay, so if we look at people for 6 months, at month 0, when they came into the study, the people who had higher cortisol levels and or higher stress levels based on questionnaires and so on, they were more likely to gain weight over that 6-month period of time. So that gives us some basis for elevations in cortisol being related to a likelihood of gaining weight, with of course no understanding of why that might be, right?
Yeah.
Just that could happen because maybe high cortisol means they weren't exercising. Maybe it meant lots of other things, right?
Yeah.
And this particular study did look at like appetite hormones, and some of those went up as well. So this is the thing. These are complicated questions that are never as straightforward as, well, the cortisol goes up and there's weight gain. Therefore, anything else that increases cortisol might lead to weight gain. That's not actually the conclusion we can take from that. And in that particular study, they also showed that stress independently on questionnaires also like predicted increase in weight gain over that 6-month period of time. So again, that leaves me to say, forget about the testing the cortisol, just do a stress questionnaire and then let's work with that because we have clarity around that. There was another study looking at women across a range of BMI. That one was quite interesting, with a conclusion that was just working theory, but in this particular investigation, they showed that there's what's called a U-shaped curve with BMI and cortisol, which meant that people at the lowest end of BMI and at the highest end of BMI were more likely to have high cortisol, and the people in the middle were likely to have the lower levels of cortisol. And important to note that the people who are at the lowest end of the BMI scale, this was not in the normal range of BMI. They were outside that range, and those people were technically diagnosed with anorexia nervosa. So that was a particular subset of a population with a lower BMI. And their working theory was that those people probably saw elevations in cortisol due to the stress of the situation. And they theorized that that's why there was like, you can have high cortisol and low BMI,
Yeah.
right? Whereas the people on the higher end of that BMI range with also high cortisol, they theorize that there's actually this bi-directional component. It's a theory. That was not what they were looking at. It's an interesting theory looking at the idea that elevations in cortisol may predispose us to higher weight, but that higher weight may in and of itself, due to potentially things like inflammatory mediators or other sort of cardiometabolic changes, predispose us to have high cortisol. And if that potentially is true, then all of this also, gets thrown out the window, right? If the reason we're seeing high cortisol in weight gain is the weight came first and then the cortisol
Yeah.
came second, then none of these other comments make any sense, right? But
Yeah.
that was a working theory, not something that they were evidencing. Okay.
Yeah. Okay.
And then I did have another one, which I've forgotten.
Or was it
but-
the HPA dysregulation and obesity review?
Tell me more.
This is the general patterns emerge, the HPA axis, the adipocyte, like up and down regulation of cortisol.
That was the one, right? So they were like, this, we observe this, there seems to be a relationship, but then not over here. And then, is
Okay.
that the one, right? So this was a really good example of, they were like, ooh, we see this thing, but not always in all the places for all the people. And then, ooh, we see the adipocytes, so the fat cell, do this thing, but like not always and not in every circumstance. And so the conclusion was, look, there are things that happen. And there may be a relationship between cortisol and weight gain. Also, maybe not always, and not in everyone. And now we're not really sure what the like through line is, but
Yeah.
there may be smoke to the fire, but maybe not. And I think it's just like indicative of the whole conversation almost
Yeah, sort
all
of
the
the
way
state of the
along,
evidence.
right?
Yeah.
It's like, yeah, TBD again.
Right.
Yeah. Yeah. But it
We're
was
working
like,
on it.
yeah. And I mean, certainly it does seem that overall, if I had to, my little mini takeaway is there probably is a relationship between elevations in cortisol and likelihood of gaining weight. But TBD,
Yeah.
all the other pieces.
Okay, cool. Yeah. Okay, so then, oh, go ahead.
Yeah.
Or did you have another
no,
thought?
I was going to just set you up. So,
thank you.
so to like end, because we're already longer than I think any other one we've done so far, but to come towards like the core of the conversation, which was the exercise piece. So I know that we looked at, you in particular looked at the different types of exercise and what that meant for weight in particular, going back to this concept of, well, if we see a type of exercise that increases cortisol than another one, does that increase weight gain? And so that type of data is harder to come by. This is why there's so many working theories and like guesstimates and like that sort of makes sense. It probably does this, but ultimately, again, point A to point B, what do the different types of exercise mean for weight management and the woman going through a menopausal transition?
Yeah. So I would say I'm not going to talk a lot about strength training because one, like, yes, I would say strength training is something that we need to be doing. So that's a little bit of a separate conversation because it's bone density. However, from an insulin sensitivity point of view, strength exercising with high intensity interval training came as a win. So I'm just going to sort of create another foundation. We've got stress reduction or stress management, and then we've got the strength training. And so we're really building out like what does aerobic training look like on top of that in relationship to weight loss. There was really nothing that looked at weight loss in menopause and those cortisol levels with the exercise, but we have great studies on what that exercise needs to be. And so I think there were two big ideas that came out of that. One, if weight loss is a goal, exercise volume probably needs to be higher than we think. So there were studies that looked at like 125 minutes versus 225 versus 300 minutes. All groups had benefit, but the group that had the higher exercise volume had greater weight loss or like free fat mass or total fat loss. And so I would say if weight loss is a goal, that like goal of 150, right? Like we want people to start where they are and think exercise is good. But if you have the availability to move from 150 closer to 300 minutes, awesome. So there's an exercise volume there. The other part of this exercise equation is like, is high intensity one like too activating, right? So it also lifts cortisol and we shouldn't do it. And there's also like a lot of prescriptions or sort of prescriptive ways that like HIIT or that high intensity interval training is being prescribed online that like, is there benefit to it? Is it raising cortisol? Can it help with weight loss? So the most common protocol for a high intensity interval training was actually 4 minutes on, 3 minutes of active recovery. That on was probably at like an 80 or 90 of your max heart rate or pretty high RP in the rate of perceived. Yeah, it's pretty high. So you're like really working, resting for 3 minutes. Interesting, there was also a 12-second on, or excuse me, an 8-second on, 12-second off, which I just think is the weirdest interval to count. I'm like, how are you going to do that timer?
Right.
But that one showed up a lot.
Really?
And there was a lot of evidence to the high intensity interval training. So there was like a little bit of the tipping of the scales that high intensity training led to a little bit more of that like free fat mass, total fat loss, weight loss, especially in perimenopausal women. So it does seem like there were groups that like premenopause, like that perimenopausal group had more benefit to HIIT. But the discussion was it's not that postmenopausal women shouldn't do it. It's just that their benefit is going to be to their heart, to their like endothelial and vascular system.
Yeah.
And so there's still a lot of benefit. So I would say probably like both are good, right? Like resistance and aerobic. If you like aerobic and you want to do longer volume in minutes, great. Probably having some of that higher intensity interval training in there, especially if weight loss is a goal, good. And those were the big take homes from that, right? Like, and again, like all of them led to benefit. And there was really like no discussion on like, did women not sleep when they started this?
Right.
But they were feeling better, right? Like they were feeling better. They were getting their goals. And then we have all of that other evidence that we talked about that I think it's not an either or, it's a both. Higher volume, maybe favor HIIT. If you're on a time crunch, I would maybe favor the HIIT.
Yeah. Yeah. And I think that's really reminiscent of lots of the deep dives in the cardiovascular realm, whether it's for things like blood pressure or, well, I'm thinking about blood pressure specifically, but there are different silos in the cardiovascular piece as well as the general piece, that all exercise is good exercise. Yes, you could probably pull out or tease out some specificity for some of that stuff. But ultimately, like we just want everyone to move more. And yes, you can double down in certain ways at some point if you've got more particular goals. But we definitely, one of the takeaways is like we definitely start with not being scared of moving, regardless of what that looks like.
Totally.
The moving is not going to hamper achieving your goals.
Yeah, and I think if you feel like the moving is, right, because this conversation will come up of like over exercising. I think the question shouldn't be whether or not to exercise, but there's questions around recovery, fueling for the type of activity that you're doing, your sleep, your stress recovery, right? Like the conversation I think is probably just misguided in the sense that people are like, oh, maybe I'm running too much. Right, that's a personal choice, but maybe the other aspects of your life actually aren't in support of that volume of exercise. That's a totally different conversation.
Yeah.
And so
we didn't think to like do some reading on fasted exercise in service of this conversation.
Yes. Oh my gosh, that would be another rabbit hole. We might be like another and like other territory. But yeah, so I think our conclusion is move more.
Yeah. Yeah. And yes. I mean, that is the conclusion. Exercise for the win.
Yeah. And like start where you can. Like, I think it's just like exercise is not easy all the time. There's a time component, there's a knowledge component, all of this. But like, hopefully this just simplifies it. Like, if you are able to move and how you move and where you can introduce more movement, all of it's going to be awesome.
Yeah. You're not doing it wrong as it relates to anything, but in particular, the focus of our discussion today, in particular in relation to feeling as well as you can and achieving your goals to the degree that you can through that menopause transition, the type of exercise that you're going to be doing is not going to get in the way. and that we need to stop overcomplicating things.
Yes.
Yeah.
Yeah.
And that the cortisol question, like there are relationships there. We're not saying cortisol is bunk. That's not what we're saying either. That there are relationships there, but that the relationships are either not clear at all in terms of whether they're meaningful or not, or even if the presence of that cortisol is real, that the exercise piece and some of the other things, like we have this like parallel evidence that is more clear cut, more solid, more reliable, and probably works quite nicely with what is actually going on with the cortisol. But
Yeah.
we can't see our way right now to making those fit entirely. So we have to trust the information that is most reliable. And right now, that's the exercise just does what we needed to do and isn't going to get in the way.
Yeah, totally.
Yeah.
All right, this is such a good discussion. Thank you for playing with me on this one
Yeah,
because I know I
not at
totally just
all.
like brought it to your table and was like, "Hey, can we put our brains together?" So I appreciate
Yeah, you
that.
did a lot of heavy lifting there, Antonella, but I'm actually very relieved to have a conclusion such as it is with this.
Yeah.
Yeah.
All right. I'll
Yeah.
see you soon.
Okay.